This lecture about bone introduced by Dr. Omar Husham. Now the alveolar process is the portion of the maxilla and mandible that forms and support the tooth socket alveoli. Functions of alveolar process: number 1, supporting of teeth; number 2, attachment of fibers; 3, resorb force. This figure show the tooth and periodontal ligaments and the alveolar bone surround the periodontal ligament and the tooth root surface. Now نشوف maxillary alveolar process in the maxilla and the mandibular alveolar process in the mandible. Alveolus is the space in the alveolar bone that accommodate the roots of the teeth. Parts of alveolar process: alveolar bone proper اللي يشمل لنا lamina dura, bundle bone and cribriform plate. Number 2, cortical bone. 3, cancerous bone. Alveolar bone proper. It is a thin layer of compact bone forming the inner socket wall, lines the alveolus, which is seen as the lamina dura in radiographs. Lamina dura, the layer of alveolar bone process, appear as white lines around the root of the tooth on radiographs. هنا البوينتر مأشرة على اللامينا ديورا اللي بالاكس راي. نشوف بالتو بيكتشرز. Bundle bone. It is referred to the bundle of the principal fibers of either the periosteum or periodontal ligament continue into the bone as Sharpie's fibers. هنا هذا فد مقطع مكبر يشوفنا السمنتوم والembedded portion of the periodontal ligament داخل السمنتوم نسميها Sharpie's fibers. أيضا داخل الالفيولار بون أيضا Sharpie's fibers، والبيريدنتال ligament الموجودة بين السمنتوم وبين الالفيولار بون. Histologically, this bone contain many small holes or opening called Volkmann's canals, through which blood vessels, lymphatics and nerves link the periodontal ligament with the cancellous bone, thus it is called cribriform plate. هذا السلايد نشوفنا الميكروسكوبيك structure of compact bone. نشوف الكومباكت بون ايضا السبونج بون. شوف السنترال of the Haversians canals واللي هي على شكل رينجز حتكون لنا الاوستيون او الهافرسان سيستم. هاي طبعا رح نشرحها هسه شوية لغ. والسيركمفرنشيال لاميلا. Now the cribriform plate هذا هو anatomical name لها. شوفها بالبيكتشرز، شوف شلون العظم كأنما مثقب. Receivable a fine hold sieve perforated by foramina. Okay. و transmit nerves and vessels. والholes Volkmann's canals، احنا نصيح لها Volkmann's canals. An external plate of cortical bone يتكون لنا من الباكال cortical plate وlingual cortical plate اللي تحيط لنا التوث والبيريدنتال ligament اللي تربط بين التوث وبين البون. هذا الدايجرام قدامنا. هنا ايضا فد مقطع عرضي للبون يشوفنا الروس ويشوفنا البون اللي محيط بالروت واللي بالبايفوركيشن اريا. شوف شلون على شكل يعني مثقب سبونج شيب cribriform plate. cancellous trabeculae or spongy bone, which is located in the space between the external cortical plate and the alveolar bone proper. They meet and fuse to form the alveolar crest. Cancellous bone, which act as supporting alveolar bone, with cortical bone surrounding the alveolar bone proper. هذا السلايد هو السبونجي بون اللي بالبون ترابيكولي والبون مارو سبيسز. هذا هيستولوجيكالي. هذا السلايد مهم ب يعني اي الراديكولار بون، كورتيكال بون، كانسولاس بون، الفيلار بون بروبر، وبالبي اكو الانتربروكسيمال بون حتى نشوف اللي صاير بين توث وتوث. اللي بين الروتات نسميه انتراديكولار بون. نشوف الالفيولار بون بروبر، الالفيولاس، سبورتنج الفيولار بون. هاي كلها تأشيرات مهمة حتى نفتهم كل اسم وين صاير مكانه وموقعه. ايضا بالسي حتى نشوف الانتراديكولار بون بوضوح اكثر، انتربروكسيمال بون، البون مارو سبيسز. Basal bone is a portion of the jaw located apically but unrelated to the teeth. The alveolar processes are subdivided according to their anatomical relationships to the teeth. Number 1. Interproximal bone, interdental septum, the bone located between the rows of adjacent teeth. 2. Interradicular bone, the bone located between the rows of multi-rooted teeth. 3. Radicular bone, the alveolar process located on the facial, lingual, or palatal surfaces of the rows of the teeth. These pictures show the interradicular septum, interdental septum, and radicular bone. The thickness of alveolar process varies from one region to another depends on the position of the teeth in the arch and their relationship to one another. Example: teeth that are labially positioned in the arch will have a thin labial radicular bone and thicker lingual radicular bone. يعني السن اللي يعني متحرك proclination اللي قدام صار بيه متقدم للأمام، فيشوفون عنده الراديكولار بون labial يكون thin بينما lingually يكون thick. Bone marrow. The cavities of all bones of a newborn are occupied by red marrow, while the in-adult jaw occupied by fatty or yellow type of marrow. However, foci of red bone marrow are seen in the jaw, which may be visible radiographically as zones of radiolucency. This picture shows the red marrow, yellow marrow, outer surface of the bone. Periosteum, outer surface of the bone, endosteum, line marrow spaces, as shown in the pictures. This is histological appearance of the bone marrow. Periosteum, outer surface of the bone, and the endosteum represent line marrow spaces. Also, this picture histologically show the periosteum and endosteum for the bone marrow. Anatomical defects of bone. هذا الموضوع جدا مهم. أولا fenstrations يشبه الويندو. This bony defect include isolated areas in which the root is not covered with bone but covered only by periosteum and overlying gingiva, and it does not extend to the marginal bone. Anatomical defects of bone. The other type هو dehiscence. This bony defect include the denuded areas which extend to the bone margin, exposing the root surface. The defect may extend to the middle of the root or further. These pictures show the fenestration and dehiscence bony defects in the so this picture show the dehiscence and the fenestration bony defect of the alveolar bone. Such defects occur on approximately 20% of the teeth. They occur more often on the facial bone than on the lingual bone, are more common on anterior than on posterior teeth. The cause of these defects is not clear but may be related to some factors such as prominent root, malposition, or labial protrusion of the root with thin bony plate. Haversian system or osteon. It is an internal mechanism that brings a vascular supply to bone, consists of central canal called Haversian canal, which in their center contain blood vessels. The blood vessels surrounded by bone lamellae, which arrange in concentric layers, constitute the center of the osteon. The blood vessels in Haversian canal are connected with each other by anastomosis running in the Volkmann canals. So the nutrition of bone is secured by the incorporation of blood vessels in the bone tissue. This microscopical structure of compact bone show the compact bone, sponge bone, and the Haversian system, which is composed from the central canal, Haversian canal, which contain the blood supply, which supply the nutrients to the bone. Around these canals there are concentric lamellated bone called osteon. Okay. Also, this slide shows the Haversian canals or systems. This slide shows the bone cells, which include osteoblast, osteocyte, and osteoclast. I will talk about the first type, osteoblast cells, which is responsible for the production of an organic matrix of bone, which is consisting primarily of collagen fibers called osteoid. This bone matrix undergo mineralization by the deposition of minerals such as calcium and phosphate, which are subsequently transformed to hydroxyl apatite. This slide histologically show the osteoblast cells and the osteoid. The other type of cells of the bone, which is the large multinucleated cells found in concavities on the bone surface called Hochschild lacunae. These cells responsible for bone resorption, which is called osteoclast cells. This slide show histologically the osteoclast cells and the Hochschild lacunae in addition to the mineralized bone and bone marrow. The last type of cells which is found in the bone, which is called osteocyte cells. The osteoblast cells that become trapped in the bone matrix and later on the mineralized bone tissue. We call them osteocyte cells. They are located in the lacunae and are connected with one another by extending processes into canaliculi through which they get nutrients and removes metabolic waste products. This slide show the osteocyte cells, which is consist of canaliculi which communicate with the other osteocyte cells for nutrient exchange and waste product. This slide show the osteocyte cells connected with the other osteocyte cells by canaliculi, osteoblast cells, which is responsible for bone formation, osteoclast, and the central canal, which contain the blood vessels supply to the bone, and lymphatic vessels and lamellae. Now, resorption of bone. Number 1, attachment of osteoclast to the mineralized surface of bone. Number 2, creation of sealed acidic environment which demineralizes bone and exposes the organic matrix. Number 3, degradation of the exposed organic matrix to its constituents amino acid via the action of released enzymes. Examples of these enzymes: acid phosphatase and cathepsins. Number 4, sequestering of mineral ions and amino acids within the osteoclast. Composition of the bone. The bone consists of 2/3 inorganic material, calcium and phosphate, and 1/3 organic matrix, 90% collagen fiber. Bone contain 99% of the body's calcium ions and therefore is the major source for calcium release when the calcium blood levels decrease. This is monitored by parathyroid glands. This diagram shows the composition of the bone from the matrix, which is composed of organic and inorganic, and the cells, which is composed of the osteoblast, osteoclast, osteocytes, and osteoprogenitor cells. Remodeling of alveolar bone. The alveolar bone undergo constant physiological remodeling, resorption, and formation in response to external forces, especially occlusal forces. Teeth erupt and tend to move medially throughout life to compensate for wearing in the proximal contact areas with an age which become flat. This referred to as physiological medial migration. Thus, osteoclast cells and bone resorption occur in the area of pressure on the medial surface, and osteoblast cells with new bone formed in an area of tension on the distal surface. This process of resorption and formation of bone is called bone remodeling, and it is important in the orthodontic treatment. This slide shows the tooth movement and the bone resorption and deposition in the process of the action of the osteoclast and osteoblast cells as a result of the pressure of the orthodontic appliance. Remodeling of alveolar bone is regulated by local influences include functional requirements on the tooth and age-related changes in the bone cells, while systemic influences are probably hormonal, example parathyroid hormone or vitamin D3. Thank you so much.